What is vital signs? Vital signs are measurement of the body's most basic function. There are four main vital signs routinely monitored by medical professionals and healthcare providers. Purpose of vital signs: to identify specific life-threatening condition, to help the physician to prescribe right treatment, to help in diagnosis of disease, the result of treatment and medication, to detect changes in client status, to recognize variation from normal and its significance. Vital signs or cardinal signs are body temperature, pulse rate, respiration rate, blood pressure, pain, also include blood sugar, oxygen saturation, SpO2. Vital signs are useful in detecting or monitoring medical problems. It can be measured in a medical setting, at home, at the site of a medical emergencies, or elsewhere. What is body temperature? Is a meaning is a measure of amount of heat in the body. This measurement represents a balance between the heat created by the body and heat lost by it. You will measure and record the body temperature in degrees of Fahrenheit and in degrees centigrade called Celsius. Temperature measurement methods. 1. Orally. Temperature can be taken by mouth using either the classic glass thermometer or the more modern digital thermometers that use an electronic probe to measure body temperature. Number 2. Rectally. Rectally. Temperature taken rectally using a glass or digital thermometer tend to be zero point 0.5 to zero point 0.7 degrees Fahrenheit higher than when taken by mouth. Axillary. Temperature can be taken under the arm using a glass or digital thermometer. Temperature can taken by this route tend to be zero point 0.3 to zero point 0.4 degrees Fahrenheit lower than those temperature taken by mouth. Oral. By ear. A special thermometer can quickly measure the temperature of a eardrum, which reflect the body's core temperature, the temperature of the internal organs. By skin. A special thermometer can quickly measure the temperature of the skin of the forehead. Types of thermometer: mercury, lattice thermometer or oral, ear, ear thermometer, skin thermometer, rectal thermometer. Factors that affect the body temperature includes exercise, emotional state, medication, stage of menstrual cycle, pregnancy. Normal temperature range for the baby 36.7 to 37.3 degrees Celsius. For children, 36.4 to 37.4 degrees Celsius. For adults, 35.6 to 36.7. For adults over age, 33.9 to 37 degrees Celsius. Pulse. What is pulse? The pulse is the expansion of the arteries. This expansion is caused by an increased blood pressure pushing against the elastic walls of the arteries each time the heart beats. This expansion rise and fall in a time with the heart as it pumps the blood and the rest as it refills. The pulsation are felt at certain points of the body where larger arteries run closer to the skin. Taking a pulse not only measures the heart rate, but also can indicate the following: heart rhythm, strength of the pulse. Pulse rate may be affected by a number of factors such as age, gender, fever, medication, illness, physical activity, and emotion. Finding the pulse. Using the first index Press firmly but gently on the artery. But the pulse use timepiece of the 30 seconds. Count the number of beats felt. Most common areas taken for pulse rate are radial pulse. Taken at wrist, this is the simplest and most common method. This is the radial pulse. Number 2, apical pulse. Apical pulse, this type of pulse is taken with a stethoscope. You will find the apical pulse on the left side of the chest, under the breast or below the nipple. This measures the heartbeat of the apex, bottom point of the heart. Carotid pulse. The carotid pulse is the pulse felt in the carotid artery in the neck, used to assess heart rate and blood flow. Major arteries pulse point. Temporal artery, carotid, apical pulse, femoral pulse, brachial pulse, popliteal artery, anterior tibial artery, posterior tibial artery, dorsalis pedis. Normal pulse range for newborn 120 to 160 beats per minute, for infant 80 to 140 beats per minute, for toddler 180 to 120 beats per minute, for school age 70 to 110 beats per minute, adolescent 85 to 105 beats per minute, for adults 60 to 100 beats per minute, older adults is 60 to 100 beats per minute. When your patient falls, you will observe these things. Rate. The pulse rate is the number of beats per minute. Rhythm. The rhythm of the pulse is how evenly spaced the beats are. There may be regular or irregular. Force. The force of the pulse is how strong it falls. May be weak or hard to feel. It is cold, tread, or feeble. Strong or very full, bounding. Always report abnormal pulse reading. This includes a rate under 60 or over 100 beats per minute. Changes from previous reading, an irregular pulse, a weak pulse, bounding pulse. Respiration rate. It is the act of taking oxygen into the lungs and expelling carbon dioxide. Respiration is defined as 1 inspiration, breathe in, plus 1 expiration, breathe out. You will count respiration by watching or feeling the patient's chest rise and fall. Respiratory rate is number of respiration in 1 minute. Normal respiration rate is 12 to 20 beats per minute. Factors that affect respiration rate: age, medication, physical activity, gender, respiration illness, heart disease, emotional stress, heat and cold. Measuring respiration rate. Rate, rhythm, character. Rate, how many respirations are there per minute. Rhythm is the breathing regular or irregular. Character is the respiration shallow, deep, or labor. Difficulty of breathing. Breathing problem may signal emergency, must be reported immediately. Sign includes the uneven breathing and rapid breathing. Complaints of shortness of breath or pain upon respiration, abnormal noises like snoring, gurgling, the accompany breathing, fear and gasping, blue color of the skin, especially around the lips, nose, or fingernail. Procedure for measuring respiration rate. Keep your finger on the patient wrist on the stethoscope on the patient chest. Begin counting respiration when the chest rise, each rise and fall, and the chest count as respiration. Record the respiration according to the facility's policy. Perform the ending procedure step. Be sure to report abnormal reading according to your facility policy. Blood pressure. Blood pressure is the force of the blood as it pushes against the walls of the arteries. When the heart contracts, it pumps blood into the arteries. This creates the greatest pressure in the arteries and it's called systolic. Pressure between contractions, the heart relaxes, the pressure on the arteries decreases. This pressure of the heart at rest is called diastolic. Recorded the diastolic pressure. You will measure and record both of these measurements. They are usually recorded as a fraction of, for example, 120/80. This represents systolic pressure of 120 and a diastolic pressure of 80. The number measured in millimeters or mercury, abbreviated mm, Hg. Hg is the chemical symbol of mercury. Stethoscope and sphygmomanometer equipment for measuring blood pressure. This stethoscope magnifies the sound of the pulse of the inner elbow, brachial artery, allowing you to hear them clearly. Parts of sphygmomanometer: the cup, the gauge holder, reverse side of range mark, index mark, hoop and loop closure, cup size, aneroid mammometer gauge, bladder hose or tube, inflation bulb, end bulb, air release bulb, and the artery level. Parts of a stethoscope: earpiece, ear tube, binaural spring, bell, a diaphragm, a tubing, a stem, and a chest piece. Blood pressure categories. Blood pressure is normal or less than 100 and less than 80 diastolic. Elevated 120 to 129 and less than. Blood sugar is the main sugar found in your body. It's your body's primary source of energy. It comes from the food you eat. Your body breaks down most of the food into glucose and releases it into your bloodstream. Blood sugar testing is an important part of diabetes care. If you have a diabetes, self-testing your blood sugar can be important tool in managing your diabetes and preventing complications. Diabetes hormones may be pancreas disease in which the body's ability to produce hormone, insulin, is impaired. It is chronic, long-lasting health condition that affect your body turns into energy. Most of the food you eat is broken down into sugar, also called glucose, and released in the bloodstream. When your blood sugar goes up, the signal of your pancreas release insulin. Insulin acts like a key to let the blood sugar into your body cell for use as energy. When to test blood sugar: before each meal, 1 or 2 hours after a meal, before bedtime snack, in the middle of the night, before physical activity, if you think your blood sugar might be too high, too low, or failing, when you're sick and under stress. Types of insulin: quickly acting insulin, 3 hours; short acting insulin, 5 hours; immediate acting insulin, 16 hours; long lasting insulin, 24 hours. NPH or regular insulin neutral protamine hagedorn. Administered once or twice daily, lower blood glucose within 1 to 2 hours after administration. Exert the peak effect of 6 to